we have to remove the stigma of addiction. That is something that people will close their eyes to, will turn away from, and it's a disease. It's not something, there's no silver bullet to fix this problem. But it's through groups and associations like Hope and Healing Center that quite frankly helped us get through it.
Good afternoon, everyone, and thank you to all joining us both in person and online today. My name is Will Bailey. I'm the Vice President of Philanthropy for the Hope and Healing Center and Institute, and I'm proud to join you today to introduce our speaker and share a little bit about the AJ Weisberger Education Series on addiction. So one of the basic premises here at HHCI is that all of our programs and services are free to anyone who comes through our doors. And we are able to do this and put on education programs like the one here today because of the generosity of people like Mark and Camille. They created this series in memory of their son, AJ, and plan to continue it next year. But this year they have attached a little Energizer Bunny to it because they have asked us to meet their match of $25,000. As you hear this series today from Vaughan, and for those of you who have heard it before, the other parts, we invite you to think about your own generosity. And if you do feel so called based on what you've heard here today, to please join us in giving so that we can continue programs like these. So a little bit about Vaughan. Vaughan Gilmore is an addiction and recovery professional and a featured speaker in our AJ Weisberger Education Series on addiction. In her professional roles, Vaughan has integrated peer recovery services into the inpatient setting and helped to implement hospital-wide outcome measures focused on substance use disorders. Her professional interests include expanding access to recovery pathways and reducing stigma associated with addictive disorder. Please join me in welcoming Vaughan.
All right, can everybody hear me okay in the room? Yes, and online we're working okay too, it sounds like. Okay, perfect. Thanks everybody for being back for this third part of this series. I'm super excited. I've just really enjoyed doing this series. It's been awesome for me to really think about like putting together kind of really when we think about addiction and the family, what kind of information and resources families might need. So I've really enjoyed doing this and excited to go over the information today as well. We've been talking about every series, sort of what is the impact on family members? And I keep coming back to this so that we're holding this in mind, right? How does addiction impact not only the individual, but the entire family system? And we've talked about how it impacts sort of the mental and physical health of the family members, the financial health of the family, and not just the people in the home, but sort of the entire family system, everybody that's involved. It's an incredibly stressful life circumstance. Obviously people here are affected by this, but really most of us are affected by this in some way or another, right? We all know someone or are connected in some way. So we've talked a lot about sort of the coping skills and the strategies for focusing on the coping skills of the family members, some strategies for sort of intervening. So we've covered a lot of that content already. If you missed it, you can sort of go back and watch the videos or get the slides from the other parts of the series. And we've really centered the conversation around what families need in order to be able to cope. We talked a lot about some evidence-based information about sort of the neuroscience of addiction. We've talked a lot about skills and techniques last time, really very specific strategies that family members can use depending on where somebody is in their stage of change to intervene. What I want to talk about today is sort of our last topic, and that is what are the support networks and community connections that family members need? what is recovery, how do both sort of families get connected to their own recovery, and then also how do we understand what recovery looks like for the individual that might have an addiction. So when we think about sort of recovery and recovery for families, we think about it, I think about it sort of covering all of these topics. I want to talk about what are the pathways and resources that exist for general recovery from somebody suffering from addiction and from the family, for the family, sort of the value of connection and community, like why do support groups really sort of help so much? And then how do we reduce some of those barriers and stigma for both the family and the individual? And I really like this graphic. This is from SAMHSA, so I can't take credit for this, but I really like it because I think it sort of helps center our thoughts around what it's like and what a family needs when they have a loved one with either a mental illness or a substance use disorder. First is remembering that these are treatable diseases. So we talked a lot earlier in the series about addiction as a chronic brain disease that is treatable, right? Most people will enter remission at some point. And I'm going to share some data about sort of some national recovery data that we have. So people can and do recover, and families can make a difference in that, right? We know that sort of family involvement is one of sort of the key things that contributes to somebody's like willingness to enter treatment, for example. I want to share a few tips today about talking to your loved one if you are concerned. I really like that they include on here to be open and honest. We often hear about sort of the genetics of addiction and how it runs in families. However, because of a lot of the shame and stigma that comes along with addiction, it's often not talked about in families. So we kind of, everybody might know that it runs in the family, but we actually are not talking about it. So the suggestion here is really to talk openly about that family history, whether you have grown children or young children, right? With grown children, it's really about destigmatizing and creating sort of an openness in terms of communication. And with young children, we can really create sort of some conversations around risk when we're open about the family history. We talked a lot last time about self-care and sort of seeking support for the loved ones. And I will talk a little bit about both of those more today. But the self-care in terms of really taking care of your own physical and mental health, both if you are concerned about a loved one and their addiction, because we know sort of the physical and mental toll that can take on somebody. So self-care is not just something we like to say, right? It actually sort of is a practice. And then finally, I really like that they include showing compassion, not only to yourself, but also to your loved one, right? Really being patient, because we know that recovery is a long-term ongoing process. And so sort of compassion for ourselves and for our family members. So I want to start off by sharing a definition of recovery. You'll see that one of the ingredients in recovery is abstinence. Right? For most people, abstinence is a key function of recovery. However, it's not the only thing that we consider when we're thinking about somebody entering into recovery. And for some people, abstinence is not possible or is not their goal, right? But recovery really is this process of improvement. It's not sort of a stagnant state that we achieve. We've recovered, and then we don't have to worry about it anymore. Recovery is really this ongoing process. And that's for the individual with an addiction and for the family, right? It's a continuous process of wellness and healing and self-improvement that we achieve sort of over time, as opposed to just sort of obtaining it and being done. And I think that's true for everybody involved. So I do have some data here from the National Recovery Survey. This was done in 2017, and I think just helps sort of frame that sort of talking point I shared about, people do recover, right? So this was a representative sample done back in 2017, looking at like how people self-identify. And they found that about 9% of the population, or 22 million Americans, say, I have resolved a drug or alcohol problem, right? So they're sort of self-identifying, I've resolved a problem. They're not saying I think I'm an addict or an alcoholic. They're just saying I think I've resolved a drug or alcohol problem. You can see that the number one substance people say that they've resolved an issue with here is alcohol, 51%. Of that sample, they sort of looked at how people got to their recovery. What pathways did people take? 54% said some type of assisted recovery, like some type of formal program, treatment, something like that. Whereas 46% of the people in the survey that said they'd resolved an issue, so they had done it on their own, right? They hadn't gotten any help. They had sort of made some type of change. Interesting, and I said abstinence might be a part of it. It might not. It depends on the situation and the individual. But 52% of the sample said that they're abstinent from all substances, right? Whereas 73% said I only abstain from the substance I had a problem with, right? Which I know in some rooms, in some communities can be a bit of a controversial sort of stance, but I think it's helpful to sort of understand where people say they're coming from. They're still saying I resolved a problem with something and I'm still using other substances without issue. Really interesting to me is it's sort of split 50-50 in terms of people saying I identify as being in recovery versus people who say I don't identify as being in recovery. So some of this is to sort of shift sort of our idea about really how somebody might self-identify and maybe what recovery looks like to everyone is a little bit different. It truly is individualized. This is just sort of one more slide on that same data set that 30% said they had formal treatment, but if you look down here at the bottom, 45% said they used some type of self-help group. And not a surprise, the two most sort of prominent self-help groups that people reported using were AA and NA. So we know that some people are recovering or resolving a drug and alcohol problem with formalized treatment. Some people are just doing it through self-help. Some people are doing it on their own. So I feel sort of confident from all this to say that there truly are many paths to recovery if you are concerned about somebody with a substance use disorder, that there's a lot of different things that recovery can look like. This is 2017, interesting, only 9% said they were using some type of medication. I think, repeating that in the future, we may see more people using some type of pharmacotherapy or medication-assisted treatment as that becomes sort of less stigmatized. So then how do people recover from a substance use disorder, or how do family members recover, right? There's a lot of different ways. So natural recovery is referring to those individuals in the survey that said, I just sort of did it on my own, right? I didn't get any help, any treatment, any support, anything like that. One of the most common ways that people recover is through a 12-step pathway. Right? They are incredibly available. They are free of cost. They tend to be sort of dispersed, right? So people have access to 12-step pathways, and the research supports 12-step pathways, right? They do work. We have research saying that they are effective. There's also lots of growing and emerging non-12-step mutual aid programs out there. Programs like Smart Recovery, Life Ring, Refuge Recovery. These programs are sort of growing in popularity. And there's also research to say that these programs work too. There's sort of some commonalities in a mutual aid program. And the same thing is true for family programs. So, programs like Al-Anon and Smart Family and Friends, all of these programs are also effective and can be both 12-step or non-12-step. A lot of people are primarily using faith-based support, sort of depending on what their spiritual orientation is. They might find their faith community is the best place for them to recover, and that's also okay. A lot of people, as we saw in the survey, are using clinical intervention. So that might be individual psychotherapy, family therapy, psychiatry, treating their co-occurring psychiatric disorders, going to residential treatment. They might sort of predominantly rely on some type of clinical intervention. Also growing and heavily supported by the research is peer recovery support services. So this is working sort of either individually or in a group with a professional that has lived experience and is sort of trained and certified to use that lived experience to sort of mentor and walk along somebody. It's different from a sponsor because it's still a professional helping relationship, although this professional sort of can be a bit of a guide and use self-disclosure, but they have a lot of training in how to use that self-disclosure in a professional way. We see sort of as part of this recovery communities, this is sort of really great services as an adjunct to clinical interventions, and peer recovery services are also helpful even if somebody is in sort of that pre-contemplation or contemplation stage of change. If you remember from what we talked about last time, that a peer support specialist can work with somebody even if they're really not ready to change or to completely stop using. They have a pretty amazing skill set. Community integration programs. So this is really about providing sort of support and structure to help somebody integrate into real life. So it's a little bit different than a treatment program. There are also some culturally specific pathways out there. And then obviously growing, especially in 2020 and 2021, is internet-based support. So there are smartphone apps that people can use as an adjunct to their sort of clinical intervention or recovery pathway. Lots and lots of forums. There's stop drinking groups on Reddit that people swear by and say that is what is helping them stop drinking. So there's lots and lots of ways. And what we don't want to do is say that there's one only way or one right way for an individual to recover or for a family to recover, right? There's lots of options out there, and it's really about finding what's going to be best. So why do support? We talk about support groups sort of being a really common sort of referral and resource that we want people to use, but why are they so effective? We have research on this too, right, that shows a lot of it is about creating a shared space, right, where there's sort of communication, there's sort of mentorship, leadership, sponsorship, people leading by example, helping relationships. And if we think about these commonalities about why support groups help people get better and recover from addiction, then we can understand why the setting, right? There's many settings where this works, right? These sort of commonalities could happen in a 12-step program, in a faith community, in a treatment center, right? In a non-12-step program where people feel like they're connected to others with shared experiences. And this is really also true for families. I mentioned last time about sort of things that families can do, but getting connected to other people with shared experiences is one of the most valuable things that a family can do if you are concerned about somebody or you're sort of in a situation where somebody in your family or that you love has an addiction. Like connecting with other people that are going through the same thing takes away so much of the stigma and the shame. It provides comfort and support and connection. Typically, these types of programs are going to have not only a focus on shared experiences, but also some type of books, literature, resources, because they're going to provide education, right, to help understand what's going on. Nowadays, almost all of them have an online component, some more than others. So there's a lot of commonalities within support groups, both for individuals and for their families. Okay. So how do we find the right pathway? Again, this is for everybody involved, not just for the individual. Really what I would say about that is the best pathway is one that somebody is willing to pursue, right? We're looking for something that aligns with our values, our belief system, our goals, right? So that we're likely to follow through on it. What we know is that most individuals will try more than one pathway. And sometimes that might be linear and sometimes that might be simultaneous, right? So in some treatment settings, people might be able to sort of be in treatment and therapy and be using mutual aid, right? Or some people might sort of try one thing and that didn't work and then try another. And all of those are okay solutions. That's really, again, where we get to some of the data where we see that it takes people up, often 2 attempts, sometimes more, right, to get it right. And we know that's because people might be trying different solutions. But there is this sort of shared mechanism of change regardless of the support program that somebody chooses. And this is increased support for behavior change. Hopefully in a mutual support program, we have decreased support for substance use, right? That's typically a component, and just increased overall support. All of these things sort of contribute to the protective factor of a support group. To sort of support this sort of recommendation, this is some research from the PAL study. Basically what they did in this study is surveyed people who were in different mutual aid organizations participating, and asked them about their behavior and the benefits of being in that program. So they looked at both 12-step programs and non-12-step programs. And found that they were sort of equally beneficial depending on sort of these factors, like, is somebody attending meetings? Do they have like a regular group or a home group? Do they have somebody that they're connected to, right? A close friend, or depending on the program, a sponsor? Are they engaged in terms of like moving towards leadership? Are they leading, convening, or facilitating meetings, depending on what it's called in that pathway? And then are they involved in other ways like volunteer or service work? So it's less dependent on the pathway that somebody selects and more dependent on sort of some of these things. Really, it's measuring their level of engagement. And so that's why we're really like encouraging people to get involved and get connected and start sort of taking on some of these responsibilities, building these types of relationships. And again, the same thing is going to be protective for family members. So what are some of sort of those more specific family support programs, and then some resources? We'll talk a little bit about Al-Anon. I'm sure people are familiar with Al-Anon. I have some data to share on Al-Anon. I want to introduce you to the Smart Recovery Family and Friends program, because I think this is a great resource. There's great other programs out there as well, and education if you're interested in it. So ACA, really they have expanded to also focus on dysfunctional families. So if you are coming from a family of alcoholics or dysfunctional families, this is a great program. The National Association for Children of Addiction does a lot of outreach and education and a lot of information for family members that might be interested or need that. The Recovery Research Institute has lots and lots of user-friendly, easy to read articles on research that family members can access, that you can take a look at if you're looking for sort of more specific information, really on a lot of the stuff that we have covered in this lecture series. I think I mentioned last time, but I included them again, the Parent Craft, which is a online training program specifically for parents when they have a child that they are concerned about, like trying to get them into treatment, trying to sort of reinforce change. It uses a lot of evidence-based sort of education and interventions for parents in particular, regardless of the age of the child. And then its sort of partner product is the Partners 20-minute guide that it's more of a workbook, but they've got a lot of information on their website as well, specific sort of tools and interventions and strategies that partners can use when they are concerned about their partner's drug and alcohol use. So Smart Recovery Family and Friends is a wonderful resource and support group focused on the family when there is addiction. Smart Recovery itself is a abstinence-based recovery program. They've got both in-person and virtual support. It really does a lot of tools. So they focus on skills development, building motivation to change, helping people sort of focus on their values, but it's sort of partner program is Smart Family and Friends. And the reason I like this program is there is the support component, but it is a lot of education and tools and training for family members. They have a workbook, they've got podcasts, they've got videos. So it is, their programming really uses a lot of the research we have on how people change to train family members to be able to use those same techniques to sort of reinforce change. So a lot of the information that we covered previously in the series on like stages of change, Smart Recovery is really making that easy information for people to digest, to use their videos and their workbooks. This is you do have to pay like if you want the workbook, but they have a lot of tools and free videos and resources and support groups on their website. And this is just directly from Smart Recovery in terms of how they explain their family and friends program. They've got the tools and support focused on the family well-being. So this is really a self-empowerment program. One thing that really distinguishes Smart Recovery from sort of 12-step pathways is there is no self-identification as an addict or alcoholic. It doesn't really sort of use that type of language. So if people have a hard time with that, or if people have a harder time with a higher power, then this can be a great resource for them, because there is no sort of spiritual component to Smart Recovery, which is often one of the barriers that we hear from people is, well, I don't want to go to those meetings, you know, I don't believe in God, or if people have had religious trauma in their life and they really want sort of a secular pathway, then I highly recommend Smart Recovery for those types of clients or family members, because it doesn't include anything like that. So it really uses a lot of like cognitive therapy, motivational interventions to help people change. And then their meetings and trainings and groups really focuses on skills training, right? There's a support element, and a lot of times what you're doing in the meeting is talking about how to use the skills or what worked. You're troubleshooting, you're supporting each other in problem solving, sort of implementing the tools and the skills that you learned. And this is just to show you they have a workbook or a handbook that can be a useful resource for family and friends. They also have a handbook for individuals with addiction that focuses on sort of their needs. And then they have a couple of other resources as well, but I would recommend those too. And again, this is focused on sort of tools and strategies for the family. The other program I want to highlight is Al-Anon. I'm sure people are familiar with this. And again, this is directly from Al-Anon, how they describe themselves. This is a mutual support group of peers who share their experience. So this is really focused on family members that are actively living with or in a relationship with somebody or navigating a relationship with somebody who has an addiction. Whereas other 12-step pathways like adult children of alcoholics may not mean that you're still in a relationship with that person. But Al-Anon is really a lot about focusing on managing that relationship, setting boundaries, setting limits, taking care of yourself. So they're really using their principles to focus on positive change that the family member can control, regardless of what sort of the family member decides to do. So every 3 years, Al-Anon does a membership survey of people that are participating in their program. And they did one this year, but that data is not available yet. And this actually should say 2018. I apologize, that is wrong. This is 2018 data. But from their 2018 survey, they had over 8,000 sort of people that were involved in Al-Anon sort of complete this online survey. And it's just really impressive what people say works for them and how Al-Anon is helping them. So if you're on the fence about referring someone to it or about attending, like it's pretty persuasive. Overall, people just say that their well-being is improved because they've been involved with Al-Anon. A lot of times people say that it's an helpful adjunct to their professional intervention. So they might be in counseling or therapy, but it's really helpful to add Al-Anon to that. And oftentimes people are referred by their helping professionals, not always. So this is just sort of some of the data. This is all available on their website if you're really curious about this. I've just taken a few of the slides. But they put out all of this data. You can see it's correct here. It says 2018 Al-Anon membership survey. But they asked people sort of like how many years have they been attending, how many meetings per week. So you can see that most people are going to sort of one meeting, and then about half of people are going to 2 meetings a week, right? So it's not a huge time commitment. What types of meetings? Mostly, this was in 2018, so I bet it would be this year's data will be a little bit different because of COVID, but back in 2018, most of the people were going to face-to-face meetings. I know that pretty much every recovery pathway out there has expanded their virtual offerings in the past 2 years, and it's much more robust in most programs. So you can see that people tend to also sort of stick around. Over half of the people here at the top have attended for 10 or more years. And so people are really getting connected and finding community in this type of setting. How effective is it? So again, they asked people to rate, like, how did it affect their daily well-being? You can see that 93% of people said it helped improve their emotional state. Right? 75% said significant improvement, right? I mean, that's pretty amazing, right? That people are saying being involved in this community of other people who are also living with a family member's addiction find this to be incredibly useful in improving their emotional state. And also they're saying that it improves sort of just their daily life, right? Just how they're feeling about their daily life, the conditions of their daily life. So this is a sort of a broad sense of improvement that people are self-reporting. And the final thing I want to share from their data set is, again, they're saying that their mental health improved. And we know that the mental and physical health of a family member who is living with addiction is significantly impacted, right? It's incredibly stressful, it's incredibly strained. It really taxes their resources and their well-being. And so we can see here that 88% are reporting improvement in their mental health. 67% significant improvement. So, I mean, this is really amazing. You can see that it does sort of, after like a year, once somebody gets to 2 years, we see sort of, it gets even better, right? When people are sort of have this community of sort of shared experience. Okay, a few other things I want to just share with you, thinking back to sort of removing some of the barriers. This is also from SAMHSA, a few just like specific tips, because this came up last time about having some of these conversations, right? So having some difficult conversations when we are concerned about somebody. And so I like, this is sort of an infographic that SAMHSA puts out, so it's easy to share with somebody if you want to. But first is having an appropriate time and place. I really like this. And I would add, they say sort of thinking about a private setting, but I would also add an appropriate time and place when there's not already conflict, right, about something else, when they haven't just shown up intoxicated and they had said they wouldn't, and you're already in an argument, right? That's probably not always the best time to express concern because it's already, everybody's emotions are already escalated. So really thinking about a private time with limited distractions where there's not a lot of outside sort of stress, if possible. It is recommended just to express your concern in a direct way, right? So you can see the examples over here of what to say. I've been worried about you. Can we talk, right? We're just using I statements. You see all of these are I statements. I'm concerned. I'm worried. I feel, right? We call those I statements because they reduce defensiveness. That's the whole point there of leading with how we feel. Certainly we want to acknowledge their feelings and create sort of an opportunity where we are reducing shame, where we're not shaming them, we're not stigmatizing them, we're not blaming them, that they're more likely to sort of shut off, right? And not be interested in hearing what we have to say. And then offering to help, right? So how can I help, right? You can see that in the example, right? What can I do to help? I'm concerned about you. What can I do to help? Right? That is not going to lead to somebody feeling defensive. We want to diffuse the defensiveness. And so maybe we can help them find some type of support or treatment. And if somebody is interested in if we're going to make this offer of help, what I would add here is we need to be prepared to follow up with that offer of help, right? How can I help? You've been thinking about going to a meeting. Can I go with you? Right? And we need to follow through on those things, right? That we have to really sort of show up if we're concerned, right? We've made that offer. And I know I already mentioned it, but it mentions it again here. And I think this is important, is being patient. And this is where some of the compassion for both ourselves and our family members comes from, where we can continue reaching out, continue creating opportunity. Now we think about sort of that stages of change model that we talked about previously, right? We're sort of planting seeds, we're waiting for somebody to be ready, and sort of move through those stages. And so if we're sort of sharing our concerns in a non-shaming, non-stigmatizing way, then we're creating an opening if somebody is ready to reach out to us, instead of completely alienating them with our anger. The last thing I want to talk about, I mentioned reducing stigma and shame, and there's one more really easy way to do this, and that's through language. So we actually have a lot of research on how language can either perpetuate or reduce stigma associated with addictive disorders. A lot of research has been done on this. And what we see is that modifying our language, both as sort of helping professionals and as family members, we can really impact some sort of how somebody's hearing us and the shame that they're experiencing. Now, I will say there is a distinction between clinical language and sort of external language versus like internal recovery language that somebody might use inside a closed sort of meeting or support program. So inside of a community, somebody might call themselves an addict or alcoholic, and there's nothing wrong with that. But what we want to be careful about, and what the research really supports, is that us as outsiders, as family members, as professionals, have to really be careful about calling somebody an addict or an alcoholic or a substance abuser, because that type of language is associated with a lot of implicit bias by healthcare providers, by family members as well. In particular, the term substance abuser or substance abuse really is historically tied to a moral model of substance use disorders and addiction, right? And we know that, we now know together, because we've gone over it, that addiction is a chronic but treatable brain disease, right? That has sort of no moral implications, right? It's not a character defect, it's not a moral failing. And so we really recommend eliminating terms like substance abuser. The research is really conclusive about the damage across the board that term does. And so I will share with you sort of a little bit of information. So there was a group of researchers in 2018 that did a study where they asked stakeholders to identify both positive and negative terms associated with addictive disorders. And so those stakeholder groups were individuals, families, and professionals. And this is sort of they sort of synthesized the list down to what showed up the most. So you can see here the negative words or phrases that really people in these different stakeholder groups want us to stop using. Individuals in recovery really wish we would stop using sort of pejorative or slang terms to refer to them when they are struggling with addiction. They don't want to be called crackheads or junkies or abusers anymore, right? There's only sort of one other category where we use the term abuser, right? And that is for like a child abuser, right? Or a domestic violence situation. So that's where a lot of that implicit bias comes from towards this term. When we're using that term, it's really strongly associated. They don't like it when we call them alcoholics either, right? That showed up on the list repeatedly. You can see here the family members list. a lot of the same terms that they wish that people would stop using to refer to their family member, in terms of sort of drug abuser, junkie, addict, and alcoholic. I really appreciate that dirty and clean showed up on this list as well, because we often use this terminology to refer to like urine drug tests, right? Being dirty or clean, or even like, so, oh, they've had a relapse, they're dirty, right? That has, again, a lot of implicit bias associated with that term. Family members also have a problem with repeatedly being referred to as codependent and enablers. Right? These are, again, sort of terms that historically have been used to blame particularly women, right, who were sort of in a marriage with a man with an alcohol use disorder. And we called her codependent, we called her an enabler. So there's a lot of negative bias associated with that terminology. And then again, you can see some of these terms sort of show up again on the professionals list. So I'm sure everybody's asking, well, what are we supposed to say, Vaughan? So the same group of stakeholders were asked to come up with positive words or phrases, right? And really what stands out to me is that people want to be identified as a person first, right? So you see a person in recovery, a person with addiction, right? So we would say that really the field is moving towards person first language. And I could talk about just person first language for like an hour and a half. So I've sort of condensed some of this for you all to give you a little bit of a snapshot here, because I think families can use this information too when you're interacting with your loved one and you're talking about them or talking to them. Right? If you are labeling them, you're such an addict, you're such an alcoholic, you're such a junkie, you keep relapsing, you're dirty. We may not mean it to be stigmatizing and shaming, but it is. And so I really like this infographic. This is available online as well. This actually comes from the Canadian Center on Substance Use and Addiction. But I like the way that they've framed this in terms of what we say versus what people hear. Right? When we say abuser, addict, they're hearing it's my fault, it's my choice, right? So we may not mean that, but that's what they hear when we use that type of language. So again, the recommendation is person first language, right? You have a substance use disorder, you have an addiction, right? But you're still a person. Like the addiction doesn't define who you are, right? You have relationships and interests and strengths and weaknesses outside of that addiction. It does not define you. It's just one part of who you are. Now, what I will also say, and share this infographic that's also available online if you're interested in sharing it, is there is a bit of an understanding here that some of that language, like self-identifying as an addict or alcoholic, can be incredibly useful for people in sort of certain settings, right? Inside of recovery communities, inside of closed mutual aid meetings, right? If somebody finds that terminology to be useful, there's nothing wrong with that. We're talking about, though, letting people sort of identify themselves, right? And deferring to their sort of preferred label, right? That's the idea here. And right on time, that is the end of my content. So I'd love to open it up for some questions.
Hi, I'm Mark. AJ is our middle son, and hi, Jack. We're entering into a season that causes a lot of pain and angst, and is pretty gut wrenching, whether you've lost a loved one or whether you have someone in addiction. So it starts Thanksgiving. It's actually started like 2 months ago. When you go into Lowe's or Home Depot or Academy, you hear Christmas music. But we celebrate Christmas in our family. Others celebrate Hanukkah or other religion or cultural things this time of year. Understand that puts a certain stress and strain on both the person in recovery and the family. In our case, we have a giant hole that we work around and talk around. And so I would encourage you, if you've got someone in recovery who may feel disenfranchised during the holiday season, talk to them. Tell them you love them, and just be there for them and understand that there's a certain amount of anxiousness in what they're doing. And the same thing with the family. You can't walk on eggshells all the time. So the best way to do that is be very transparent and open. I clearly do not have all the answers, or I wouldn't be here. So every situation is different. Every family dynamic is different. So do what works best for you, but think, it doesn't have to be the same way it's been. So you can try different things or learn different things. So thank you, Vaughan, for doing the 3 sessions here. We've got one more session in January that finishes this year of the AJ Weisberger series. But thank you all for your attendance and for your support.